Hello, everyone. I welcome you once more to this station, Bright Medical Imaging Solution. Bring to you a simplified explanation on ultrasound basic principles and physics. This is the simplest explanation you can get to help you understand the working principles of an ultrasound machine. So let's just take it gradually as we move into the basic physics of ultrasound. To effectively use ultrasound, it is important to understand both the basic physics and the clinical concepts behind it. Ultrasound imaging system use a transducer. Take note of that word, transducer, also called an ultrasound probe, to send sound wave into the patient's body. This sound wave travel through the tissues and are reflected back as echoes when they meet structures like organs, boundaries between different tissues. The ultrasound machine processes these returning echoes and converts them into black and white images on the screen. Ultrasound works by producing tiny mechanical pressure waves, essentially sound wave, at frequency above human hearing. The wave are generated, transmitted, and received by the transducer. Inside the transducer are piezoelectric elements or piezoelectric materials. When an electric current is applied, these elements rapidly expand and contract, creating sound waves that travel through the body. When the waves hit tissues, they bounce back to the transducer where the echoes are detected and processed to form real images. Now let's take a look at ultrasound image formation, how the images are being formed. The first step is transmission. Here, an electric current activities. Here, an electric current activates the piezoelectric element inside the transducer. This generates a pulse of sound wave that travels through the patient's body at a speed of about 1,540 meters per second in soft tissues. The next step is reflection. When the sound wave encounter internal structures, some of the waves are reflected back to the transducer while continue deeper. Then the next step is reception and processing. The transducer receives these returning echoes because the speed of sound in tissue is known. The system calculates the depth and location of each structure based on how long the echoes take to return. Image display. Shallow structures closer to the skin reflect echo sooner, so they appear at the top of the image. Deeper structures take long to reflect echoes, so they appear lower on the screen. This process happens so quickly that the ultrasound system can display real-time moving images, making it possible to observe organs in motion, such as the beating heart or blood flow. Let's now take a look at this principle we just saw with these images we have here. First and foremost, this is an image of a trolley-based ultrasound system where we have the probe ports. We have about four probe port connectors here, and the different probes here, like the linear probe you can see here, the curvilinear, the volume probe, the transvaginal probe, and the cardiac probe. So we have about 5 probes available here. So here we have the monitor, which is where you view your images. We have the touch screen. This is a touch screen. It's like a slave console to the main console, where you have other options and varieties you may need to select. We have the speakers. There are cases you may need sound to aid your procedure. We have the control panel, which is the main panel that contains all the knobs you use to work on your images during the procedure. We have handles. Yes, we have handles on the ultrasound machine to facilitate movement and adjustment of the machine. We have probe holders. Every machine should have a probe holder. This helps to keep your ultrasound probes safe, because when these ultrasound probes falls to the floor and experience any form of fracture or crack, that can damage these probes, and these probes are very expensive. So ultrasound machine usually comes with probe holders. Then USB ports for connectivity, where you can as an input or output device, where you can input some information into the system, and also take out information from the system. We have probe connectors, like I earlier showed you, where you can connect your probes to the machine. Then we have lockable wheels, for the trolley base, where you can lock your wheels to avoid movement during procedure. So this is just a simple description of an ideal trolley based ultrasound machine. Let's now look at the working principle, like we saw, of an ultrasound machine. Here, this is the ultrasound machine with the operator console, the monitor, then the processor that contains the probe connectors and other accessories. Now, from this console here, where we have the ultrasound processor, electrical signals are generated by the machine inside this ultrasound machine. Now, that electrical signal travels through the ultrasound cable into the ultrasound probe that contains transducers, which we call piezoelectric materials. Now, these transducers, when they receive electrical signal, they vibrate, and after vibrating, or while vibrating, they emit sound energy into the tissue of interest. Now, this is a human body, where we can see the kidney. The organ here represents the kidney. Now, this energy, that electrical energy that resonates on this transducer, cause it to vibrate. That vibration produces sound energy. But the sound energy we are looking at are energies of very high frequencies that are above 2 megahertz, ranging between 2 megahertz to 20 megahertz. Now, this probe, as we can see, let's say it's making use of 3.5 megahertz. That's a very high energy, sound energy. When this energy gets into the organ of interest, it gets reflected in form of echo. Now, depending on the density and surface interaction and everything we are going to see in the course of this lecture, that will determine the amount of sound echo that comes back, because that echo is also received by this transducer. Now, this transducer has dual function. It can convert electrical energy into sound energy, and it can also convert sound energy back into electrical energy, which goes back to the system and is being converted to black and white image you can view on your screen. With the help of some other accessories, these things can be made to appear as colored. So this is just the simple principle, guiding the operation of an ultrasound machine. So let's just recap on that. The system generates an electrical energy that travels through the probe. On getting to the probe, through the wire, on getting to the probe, there's a piezoelectric material here called transducers that vibrates on vibration to produce frequency of high energy, sound wave of high frequency that penetrates the structure of interest. Then, on interaction with the surface of such organ, that sound energy is reflected back to the transducer. The transducer receives and converts the sound energy back into electrical signal with image details, and the machine processor processes this image and display them as ultrasound images we view on the screen. That's basically the simple principle on how ultrasound works. So, like you can see on the label here, this is the original wave coming into the probe. Then we have the transducer. Also take notes, there's usually a gel placed between the transducer footprint and the surface of the patient's skin, because air is usually trapped between the patient's skin and the probe interface, which inhibits the transmission of ultrasound energy. So we need a coupler such as gel to eliminate the presence of air. That's why gel is usually used during ultrasound procedure, basically to eliminate any form of air between the skin and the footprint of the transducer. So that's why you have the gel there. Then this is the skin of the patient, the tissue, and the organ of interest. Now these are the wave, sound wave, the coming in sound wave, which is this, and the reflected sound wave, which is the smaller dotted line you see there. So you see the reflected wave going back. So this is just the simple process on how ultrasound imaging procedure is being achieved. Now let's understand sound beam interaction in ultrasound. Some sound beam interaction. When ultrasound wave travel through the body, several interactions occur. This affects image quality. Please take notes. This interaction affects image quality, brightness, and clarity. The main interactions are attenuation, reflection, and scatter, and the need for proper acoustic coupling. So let's take a look at the first, which is attenuation. Attenuation is the weakening of the ultrasound signal as it travels through tissue. Causes of attenuation include: the main source is absorption. When organs absorb ultrasound energy, it causes attenuation, reduction of the energy of the sound waves, where acoustic energy is converted into heat. So attenuation creates conversion of ultrasound energy into heat. The effect of this is that the deeper the structure, the weaker the returning echo. So deeper structures attenuate more and causes weaker returning energy, which can affect the image quality. So deeper structures may appear dark or less clearer. One way to compensate for this decrease in or loss of energy due to thickness of area of interest, we use the time gain compensator, that is the TGC, which you should have seen in the previous lecture, or the gain. Now, in this situation, the TGC or gain is increased at deeper levels to brighten the image and make deeper tissues visible. So that's under attenuation. Then the next interaction we look at is reflection. Occurs when a sound wave encounters a boundary between two different media, e.g. tissue and bone. Key points we consider here: the angle at which wave hits the boundary equal to the angle at which it reflects. We will still see an explanation of this in subsequent slides. Bone and air are strong reflectors. In fact, the ultrasound imaging procedure, we normally have issues with these two structures, that is bone and air. They render very adverse effect on ultrasound images because they are strong reflectors, causing most of the wave to bounce back. So when you have any structure behind a bone, you can't see that structure because the bone causes total reflection. So no wave energy gets to the structure posterior to this bone. Air, the same. Whenever you have a structure posterior to air, and ultrasound energy cannot get to them because there's total reflection of that sound energy, making it impossible to visualize those structures posterior to this to bone or air. This creates acoustic shadowing, which we'll see in our evaluation of artifacts. So this creates acoustic shadows because little or no sound passes through to deeper tissues. I hope that is clear by now. Then the last interaction we have is scattering. Scattering. This happens when ultrasound waves strike irregular or non-homogeneous surface. The effect is this: echo scatter in many directions, creating speckles. the grainy texture seen in ultrasound images. Some scatter helps form image texture, but too much reduce clarity. So scatter has its own advantage and disadvantage. Now let's look at this image to help us understand what we mean by interaction within the human tissues based on sound energy. So when sound wave is propagated through some structures, such as very structures with very high density, there's usually what we call absorption. There's total absorption that inhibits returning echoes. So when there's total absorption, you lose images, you don't get images. That's why when you are scanning a very bulky patient with so much tissue, it's difficult to visualize images because there's total absorption. Then the next is reflection. In reflection, it helps to reflect the echoes which the transducer receives and creates the images. That is to say that ultrasound imaging functions more with reflection. Total reflection is more ideal for adequate image formation. Then we have scattering. Scattering occurs, like we saw, when the surface is irregular. When ultrasound wave encounters irregular surface, the sound is scattered at different direction. So this affects the amount of sound energy coming back to the probe. Remember, the principle is sound wave is emitted on interaction, it comes back as echo to create our image. So anything that will affect the amount of energy coming back will adversely affect the image we are getting. So scattering, it poses a lot of difficulty to image visualization. So that's why you must ensure your probe is, you're evaluating structures with well-defined surfaces. Then we have refraction. For refraction is when sound wave encounters object or images at a very different angle. This results to such sound wave being refracted towards a different angle, so you lose returning echoes. So all of this, absorption, scattering, and refraction, creates loss of image quality, whereas reflection is what gives us what we want to produce the kind of image we desire. Also, looking at this diagram here, we can see the effect of sound energy on different materials such as fluid, tissue, bone, and air. Now for fluid has a total transmission of sound wave. It allows for adequate transmission of sound wave, which allows us to get adequate transmission and reflection. That's why structures that contains fluid are usually used as acoustic windows. That's why if you are scanning the uterus, you use the urinary bladder as an acoustic window. It helps for total transmission of ultrasound energy. Whereas for tissue has higher density, therefore leads to attenuation, absorption. So that absorption will affect the amount of energy that gets to deeper structures. That's why you can see a reduction in the energy here. Whereas for bone has what we call total reflection or absorption. Here, once ultrasound gets to this, it's totally absorbed or reflected. So you don't get any energy that goes through to visualize whatever is beyond. So what you see below the bone is shadowing, acoustic shadowing, because there is no amount of energy, ultrasound energy gets there. The same thing is applicable for air. There's total reflection. So this total reflection leads to shadowing too, where you can't appreciate any organ below this. We'll get to see all of this in subsequent images. Okay, so let's now take a look at understanding ultrasound physics and image quality. Let's look at image quality. Ultrasound imaging depends on how sound wave interacts with the body tissue. Several factors, including frequency, attenuation, reflection, and absorption, affect clarity and quality of images. Now, the first we look at is acoustic coupling. Acoustic coupling. Sound cannot travel through air because air reflects most of the ultrasound waves. By now, we should have understood that. The solution to this is acoustic coupling. Ultrasound gel fills the air gap between the transducer and the skin, ensuring smooth transmission of sound wave. One problem is this: if air is trapped under the transducer, it reflects the waves and creates shadowing, preventing imaging of deeper structures. So that's where acoustic coupling comes in. Then another thing that affects image quality is frequency and wavelength. Frequency is the number of sound wave circles per seconds, whereas wavelength is the distance a wave travels in one circle. One positive plus one negative pressure changes. Now, low frequencies travel deeper with less attenuation. That is, ultrasound energies with low frequency travel deeper. They can penetrate deeper and with less attenuation. Now, low resolution, the effect of this is that it comes up with images with low resolution, but good for imaging deep structures. So there's a compromise here. If you are evaluating a structure that is bulky, you need a sound wave that can penetrate deeper, but you should be ready to sacrifice resolution. Your image may not be as clear as you want. So that's why if you are evaluating obstetrics or abdomen, you use probe with 3.5 frequency, which is low. But when you are examining breast, you use probe of higher frequency like 7.5 megahertz, which can travel less distance but good resolution. So for low frequencies, you get good depth, but you get reduced image quality. Then for high frequencies, it provides better resolution but less penetration, just like I explained. But for shallow structures, e.g. thyroid and breast, high frequencies are very, very ideal. So most linear probes are built to function with high frequency, whereas curvilinear probes are built to function with low frequencies. Now let's look at the different degrees of sound energy, type of sound, and frequency range. The audible sound you hear, just like you are hearing me, ranges between 16 to 20,000 hertz. 16 to 20,000 hertz, whereas ultrasound energy ranges between above 20,000 kilohertz. That is ultrasound energy. But when we talk of medical ultrasound energy, it ranges between 1 to 20 hertz. That's why most of our probes are between 2 to 15 hertz or 2 to 20 hertz. More modern ultrasound comes with higher frequencies. So you can see ultrasound machines of with 1820 megahertz. Okay, so we now look at continuation of image quality. The third one is attenuation and signal amplification. Just to help you understand, like low frequency bass sound travel through walls. If you can observe, if you're in a place where musicians are rehearsing, you will always notice that the bass sound gets to you easily, more compared to the sounds with higher pitch. This is because low frequencies travels deeper through structures. So you can hear a bass sound from a very distant location than sounds with higher pitch. So lower frequency ultrasound waves penetrate deeper into the body. That's just what this is trying to explain to us. Let's now look at attenuation and signal amplification. Attenuation, the weakening of ultrasound wave as they travel through tissues. The result of this is that deeper tissues produce weaker echo and may appear darker or dark. The solution is the time gain compensation, the TGC, which helps to amplify echoes from deeper areas to brighten the image. Then the next we see is reflection, absorption, and scattering. Now, reflection occurs at boundaries between tissues, e.g., soft tissue bone, soft tissue air, create strong echoes and acoustic shadows behind dense structures. For absorption, convert sound energy into heat, limiting penetration. For scatter, produce the grainy appearance or speckles in ultrasound images. Key take home from this image analysis: ultrasound images are created by listening to echo from structures. High frequency gives us better resolution but shallow imaging, whereas low frequency gives us deeper imaging but lower resolution. Air and bone reflect ultrasound waves, preventing imaging behind them. Amplification (TGC) helps visualize deeper structures clearly. Okay, so let's now look at transducers type, the different types of transducers, that is ultrasound probe. The first we have is the curved or convex array transducer, what we call the curvilinear probe. An example of it is what we have here. It has a curved array edge, curvilinear. Here, the active elements are arranged in a curved line, creating a sector-shaped image. This wide aperture gives a broad field of view, both near the surface and deep inside the body. This makes it ideal for abdominal scan and fetal imaging, where seeing a large area is important. That is for curvilinear probe. Then the next is the phase array transducer. Here, the elements are arranged in small row with a compact footprint. The beam are electronically stirred to form a pie-shaped image. Though the near field resolution is lower than the convex array, its small size allows imaging through narrow spaces, such as between the rib for cardiac scans. These probes are usually used, they are also called cardiac probes, used in echocardiography, to scan the heart through the ribs. Then the last is the linear array transducer. With elements in a straight line and no stirring, it produces evenly spaced beam with high resolution images. This makes it perfect for vascular imaging and superficial soft tissue studies. So these are examples of different kind of probes you can make use of. Here is the phase array, that is the cardiac probe. Here is the linear probe. Here are examples of linear curvilinear probes, but this one has a different shape. This is the main curvilinear probe. Then this is the volume probe. Then this is the transvaginal probe. So these are examples of probes we should be familiar with. Then scanning plane, very important. When imaging with the ultrasound devices, we deal with different scanning plane. Most ultrasound transducers have a small bump or mark or indicator at one end. This indicator corresponds to the first element of the transducer and matches the marker on the left side of the ultrasound image. When the transducer is placed on the anterior surface of the patient with the mark facing the head, structures towards the head will appear on the left side of the screen. Rotating the transducer 90 degrees counterclockwise gives a transverse view where the patient right side appears on the left side of the screen. Now, let's go over the four main scanning planes. So we have four major scanning planes. The first is the transverse plane. The transverse plane. Now, the transverse plane is when you are cutting the body into two parts. So let's take, for instance, this image you can see behind here. This is the head of this person. This is the neck. This is the body. I hope this will help us. So when we are talking of transverse plane, you are cutting the body into that part into two, where you have superior and inferior. That's for transverse plane. Then we now have the longitudinal plane or sagittal plane. The longitudinal plane or sagittal plane is cutting the body into two halves, where you have right side and left side. That's for the longitudinal or sagittal plane. Then we have the coronary plane. The coronary plane is like cutting the body into two halves from the side, where you now have the front and the back. That's the coronary plane. Then finally, we have the oblique planes. So let's take a look at them. The transverse plane runs parallel to the ground, separating the head superior from the feet inferior. The longitudinal and sagittal plane runs perpendicular to the ground, dividing the body into half and into left and right sections. Coronary plane separates the body into anterior front and posterior back sections. Then oblique, oriented at an angle to other planes, used to view structures not aligned with standard plane. So oblique plane are just an additional makeup to help us complete our imaging procedure. Okay, so let's take a look at the various modes. Modes, very important in ultrasound. So we have different types of modes. The first is the real mode, which we call the B mode, bright mode, brightness mode. This is the most commonly used mode in ultrasound. It creates a real-time two-dimensional image using different shades of gray to represent tissue structures. The brightness of each structure, also called echogenicity, depends on the strength of the returning echo. Stronger echoes appear brighter. B mode is used for most anatomical imaging like abdominal and obstetric scan. Then we have the M mode, which is the motion mode. Here it captures returning echoes along one scan line and displays them over time. This is useful for analyzing motion patterns such as cardiac motions and fetal hearts. Measurements such as beats per minute can be obtained directly from the M mode image. We also have the Doppler mode. Here examines the frequency shift caused when sound wave interact with moving targets like red blood cells. If blood is moving towards the transducer, echoes return sooner. If moving away, they return later. So color Doppler displays blood flow directly and velocity in color, while pulse wave Doppler allows precise measurement of flow at specific locations. It samples a specific point in a blood vessel and provides accurate information about both the highest and the lowest blood flow velocity at that point or that spot. Color Doppler displays the speed and direction of blood flow in color. Then we have the red typically indicates flow towards the transducer, whereas the blue indicates flow away from the transducer. A spectral display can be used to measure the exact velocity of blood flow. We also have the power Doppler. Power Doppler focuses on the strength, amplitude of the returning signal instead of velocity. This makes it more sensitive for detecting slow-moving blood or flow in small vessels. Okay, so let's take a look at a very important aspect of ultrasound physics, which we call ultrasound artifact. Ultrasound artifact. An ultrasound artifact is any image finding that does not accurately represent the anatomy or pathology of scanned structure. Artifacts can sometimes mimic disease, hide real pathology, and provide useful information about tissue composition. Artifact occurs because ultrasound waves interact with tissues in complex ways, and the assumptions made by the machine's processing system may not always hold true. Common causes of artifacts. Let's take a look at the common causes of artifact. The first is assumption errors. The machine assumes the sound travels in a straight line at a constant speed of 1540 meter per second and reflects only once before returning to the probe. If these assumptions are violated, artifacts occur. So acoustic properties, variation in tissue density, speed, and reflectivity affect sound transmission and reflection. Beam characteristics, which is the third. Ultrasound beam width, focus, and side lobe can cause false echoes. So let's look at the types of ultrasound artifacts. The first one is the propagation artifact. propagation artifact here caused by errors in assumption about sound travel path or speed. So examples of this is reverberation artifact. Multiple reverberation between two strong reflectors create parallel lines on the image. Examples are air in Bowell loops. Air in Bowell loops usually creates what we call reverberation artifact. Then the next is comet tail. Comet tail artifact, a type of reverberation but with closely spaced echo that looks like a bright tail. Example is a metal object. So ring down artifact simply similar to comet tail but from air bubble forming a continuous echo. Then the next um, ultrasound artifact we have is the attenuation artifact caused by different rates of sound weakening in tissue. So acoustic shadowing. Behind a strong reflector, e.g. bone or gallstone, little or no sound penetrates, creating a dark area. Enhancement, fluid filled structure, e.g. cyst, allow more sound pass through, making tissues behind them appear brighter. Then edge shadowing. This has to do with refraction or scattering at the edge of a curved structure, causing shadowing. So we now have the third one, which is the Doppler artifact. It affects blood flow measurement. Examples are aliasing, occurs in pulsed Doppler when Nyquist limit is exceeded, and if waveform trap around. Image or mirror artifact, flow appear duplicated on the opposite side of the strong reflector, e.g. diaphragm. That's the mirror image. Then we have the refraction artifact, lateral displacement. Object appear at incorrect location because the beam is bent by curved surfaces. Then we have side lobe and grating lobe artifact. Here, extra echoes appear because weak beam outside the main ultrasound beam reflects from strong interfaces. Speed displacement and artifact. Structures appear closer or farther because the sound speed in that tissue is not the assumed 1540 meter per second. Then clinical importance, negative impact, may mimic pathology, that's false positive, or hide real lesions, false negative. Positive impact, some artifacts like acoustic shadowing, gallstone or enhancement, cyst help in diagnosis. So let's take a look at some of the artifacts. Here you have an example of what we call posterior acoustic shadow. This, the organ you see here is the gallbladder, then this is a calculi to help you, understand how posterior acoustic shadow work. So this calculi within the gallbladder absorbs the entire sound wave and does not allow anything posterior to it to be visualized. So that's how you get, acoustic shadow. Then we also have the one we call the reverberation, which is mainly seen when sound interacts with air in the bowels. It creates, multiple stretches of line. Multiple stretches of line, which we call reverberation artifact. Then we also have the comet tail. You can see these spikes looking more like this reverberation, but this is a very tiny specks emanating from this structure. Mainly the gallbladder is usually seen within the gallbladder. Then we also have the mirror artifact. As you can see on this assessment of the liver, this is a liver lesion here, but you can also see it here. This is the normal image, this is the reflected image. You can also see this mass here. So an inexperienced person may conclude this as double mass there, whereas this is just a normal lesion but reflection. Okay, So the next one we see is still an image showing reflection. So we'll now go on to common terminologies we use in ultrasound. Common terminologies. I'll be fast with this. Now we'll start with the echogenicity. This describes how well a structure reflects ultrasound wave. Structures that reflect more sound waves appear brighter, that is white. Those reflecting fewer waves appear darker, gray or black. Hyperechoic means very bright on the screen because the structure reflects lots of ultrasound wave. Example include bones, calcifications or fat. Then we have hypoechoic means darker than surrounding tissues because the structure reflects fewer ultrasound wave. Examples, some tumors, lymph nodes or certain organs. Then we have isoechoic. Isoechoic means the tissue has the same brightness, echogenicity, as the surrounding tissue, making it blending. Example is normal liver tissue, next to the spleen, may appear isoechoic. Also, we have anechoic. Anechoic means completely black because the structure does not reflect any sound wave. Example, fluid-filled structures like cyst, bladder, or blood vessels. Then we have acoustic shadowing, a dark shadow behind a structure that blocks the sound wave. Example, stones or bone casting shadow because sound cannot pass through. Then we have posterior enhancement, the bright area behind a fluid-filled structure because fluid allows sound wave to pass easily. Example is bright area behind the bladder or cyst. Then we have attenuation. This is the weakening of the ultrasound beam as it travels through tissue. Causes include absorption, scattering, and reflection. The deeper the sound travels, the weaker it gets. We have the reverberation artifact occurs when sound waves bounce back and forth between two strong reflectors, creating multiple equally spaced bright lines on the image. Examples are air bubble or metallic objects. Then we have resolution, the quality of the ultrasound machine to distinguish two separate structures lying close together. High resolution equals to clearer image. We have gain, the brightness control on the machine. Turning up the gain brightens image, turning it down darkens image. We have Doppler effect, uses sound waves to measure movement such as blood flow, red color, then blood moving towards the probe, blue color, blood moving away from the probe. So here we're trying to say when we have a red color, it means blood moving towards the probe. Then when we have a blue color, we have blood moving away from the probe in Doppler studies. Artifact, any false or misleading image on the screen that doesn't represent real anatomy. Example, shadowing, reverberation, or mirror images. Okay, so we'll now take a look at common terminologies and how we can appreciate them on the images as we can see. So you can see this image here that looks like a cyst. This is a cystic image. It appears anechoic, that is echolucent. Anechoic structures are echolucent. They are devoid of any echo. Then we have hypoechoic. Hypoechoic when the tissue compared to the surrounding is lacking echo. That is when it is less echogenic than the boundaries. So you can see this one looking more blacker than or darker than this surrounding tissue. Here, hyperechoic or echogenic, you can see this mass looking more whiter than the surrounding background. So this mass is more echogenic than the environment, this mass is more ecopenic or hyperechoic than the surrounding structure. So echogenicity is relative. So let's now look at these other examples. Here we have four different masses in this slide we have here. We have this first one, isoechoic. Isoechoic meaning that the mass has same echogenicity as the background. So you can see a mass here. There's a mass here, but we can't appreciate it very well because it has the same echogenicity with the surrounding mass. So it's difficult to identify. So isoechoic masses are very, very difficult to identify. Then we have the hypoechoic, where it appears less, it appears darker than the surrounding environment or surrounding boundaries. So you can see this is appearing darker than the surrounding boundary. This is what we call hypoechoic mass. Then we have hyperechoic or echogenic. Here you can see this is hyperechoic. It has more whitish, background than the normal boundary. Then lastly we have the anechoic. Anechoic, devoid of echo. So you see this lesion like a cystic mass, here with a more echogenic, surrounding. So these are the terminologies we use to describe masses in ultrasound.